So what you need to do these is one pillow and a patient. So go ahead and lay on your side facing me. The reason why you need this is to protect the patient and yourself, right? So the patient's going to scoot way close to the edge of the table. You're going to use a pillow to make a barrier between you and the patient, right? Because you're going to lean over the patient. Some patients don't like that. Scoot closer to me. All right, so their hand rests on top of their side. So what do you guys know that when you raise your arm overhead, which directions is the scapula move? So, no, you're going into flexion. Just straight flexion. Okay, so posteriorly glide, inferiorly tilts, right? That's the first scapula thing we're going to do, okay? So what you're going to do is stagger stance, put your left foot, if you're working on this side, I like to put my left foot forward, right foot back, lean over the patient, and what you're going to do is you're going to find that inferior angle of their scapula, right? And you do like a hamburger or what's called a lumbrical grip. Lobster hand. Yeah, so you're going to grab that inferior angle with your lobster hand, okay? This hand comes to the front of their shoulder, and what you're going to do is you're going to gently push back. So just a little back to set the shoulder blade on here. The reason being is this is your scapula, this is your rib cage, it sits on top of it. You need to get it over the lateral angles of the ribs. So by grabbing with your lobster claws and pushing back a little bit, that sets it where it needs to be. The technique is basically you're going to shift that way. So it's a posterior tilt inferior glide. So I'm here grabbing Robert, my hands are on top of his shoulder. I'm just gonna posteriorly tilt inferiorly glide. So just like that. So all I'm doing is I'm doing this. So you guys have learned, you know, this, right? Got a little of this action going on. You got a little of this action going on. I got a little of this action going on. It's my dance moves. Right? So here, again, grabbing, split stance, whatever you want to call it. Top hands here on the shoulders, and I'm rocking back. Right? And it's a good amount of force, okay? I mean, really kind of shove into it. You're not going to hurt it, right?
It tickles.
It does tickle. The other technique you can do, and you got to be careful, obviously, where you're putting this hand, because there's sensitive tissue in the front. You want to stay up near the shoulder, right? Don't get handsy. Use your lobster grip, and what you can do is you can do distraction. Distraction essentially is all you're going to do is grab the shoulder blade, and you're going to try to lift it off the wall, right? And then relax. So try those two techniques real quick. Just